So how important would you say is it in order to trace where the coronavirus is coming from?
So I think I wouldn't necessarily say it's important to trace where it's coming from. Our emphasis is really to trace, not necessarily trace, but prevent it from spreading further. So when we get a patient that's diagnosed, we never really approach it with like, where did they get it? Because there's honestly no way to know, and it doesn't really affect the outcome. But we will say, okay, who have you been in contact with? We need to reach those people and keep those people from infecting more people. So we kind of approach it from the upstream approach and keep it from going further downstream.
Mm-hmm. Has this been a successful approach, I guess, in a way?
I think it's one of the things that you'll never know if it's successful, because there's no way to measure what would have happened had you not done it. Mm-hmm. I do think this is just my personal, what I'm seeing is, we're definitely quarantining large amounts of people and providing them resources. So I do think that's slowing the spread. Yes. But I think it's hard to say objectively whether or not it's successful, because there's no really measure of what would have happened had we not done this, if that makes sense.
Yeah, that does. What kind of challenges are you experiencing while you're tracing the virus?
I would have to say the greatest challenge is the lack of resources available to this population, and lack of resources available to us to help treat them. The lack of resources has been a huge thing, because we're very good and very able to identify problems, but having the things we need to be able to treat those problems and intervene is not always there. This is a very complex population that has a lot of needs, and we don't always have a way of fixing those problems. And the area itself is so spread out. I mean, it's not uncommon to have a household that's 15 miles away from any other household. Mm-hmm. So it's not an easy thing to go check on these people, to get them to physically get them the resources that they need. I mean, when we are doing home health visits, 4 visits could take up an entire day just because of the region. Wow. So, and they're facing, when the public health nursing department mandates a 14-day quarantine, that's 14 days off of work, and there's no income guaranteed from anyone. So that's a challenge in itself that we can't address. So there's a lot of problems and a lot of chavlenges that we're facing.
Yeah, and I know you said earlier when we talked, you said that a lot of people were having issues with having access to water, just simply washing their hands, and you were assisting with things like that.
Yes. So that's been a huge issue. I'm glad you brought that up. A lot of these people don't have running water. So that has definitely contributed to the spread. We do our best to provide them with at least hand sanitizer, or try to suggest that they, if possible, go stay somewhere else. A lot don't have electricity. So, if you're trying to keep someone from spiking a fever that will make them get worse, that's really hard. We don't have air conditioning. So we are trying to work with hotels in the region,